Hi, podcasters. I'm Dr. Mary Larajani.
And I'm Dr. Rina Lau.
And welcome to the Skin the Surface podcast, where we are going to address various topics related to your skin. Happy New Year, and welcome back, podcasters, to Skin the Surface. On today's episode, we will discuss one of the most common skin conditions we see. Believe it or not, it's not usually the main reason why people visit their dermatologist. Oftentimes, people don't even realize that they have this skin condition.
I think I know where you're going with this, Mary. This mystery skin condition may initially start out as an occasional flushing and blushing on the cheeks. Then over time, it may be more persistent and flare with that occasional glass of red wine during a holiday party, drinking caffeinated beverages during your morning commute, or even completing a vigorous workout.
I can totally relate to some of that, as I'm sure many of our listeners can as well. What Rina is hinting at is a chronic but often treatable skin condition called rosacea. This is an important topic to discuss, not only because it's a common concern for many of our patients, but nationally, rosacea affects an estimated 14 million Americans.
Wow, I didn't realize rosacea impacted so many people. I actually came across a statistic recently from the National Rosacea Society that 90% of rosacea patients expressed a lowered self-esteem and self-confidence, and 41% reported that the rosacea had caused them to avoid public contact and social engagements. So this is even more important because rosacea not only affects the skin, but impacts your overall well-being and interpersonal interactions.
I couldn't agree more, Rina. So we've started to discuss some of the features of rosacea. For our listeners, can you go into some more detail about the major signs of rosacea?
Of course. Persistent facial redness is the most common individual sign of rosacea. We call this erythematotelangiectatic type of rosacea. This may resemble a blush or sunburn that just doesn't go away. Many people with rosacea also experience frequent flushing, which is redness that comes and goes. And this may actually be one of the first signs of rosacea. This facial redness may be accompanied by a sense of heat, warmth, or burning.
The burning sensation is not just limited to the face. Some patients actually can experience a burning sensation in their eyes. The eyes might become irritated, watery, or even bloodshot, and this is actually its own subtype of rosacea called ocular rosacea. If you ever experience any of these symptoms, it's really important to contact your dermatologist and ophthalmologist. So, Rina, are there any other ways that rosacea can present?
Absolutely. Some people with rosacea may experience the dreaded acne bumps and pimples that accompany facial redness. This subtype is called acne rosacea or inflammatory rosacea. This type of acne is different in that the blackheads and whiteheads are absent. Because this differs from a normal acne breakout, the treatment itself for acne rosacea may differ, which we will discuss in a little bit. So, Mary, we had mentioned the facial redness, flushing, and acne breakouts. Is there anything else to look out for? Any other signs?
Yeah, so one last subtype that's the least common but potentially the most disfiguring is phymatous rosacea. So phymatous rosacea can occur anywhere on the face, but we most often see it on the nose, and we call this Rhinophyma. And this occurs when someone's had long-standing rosacea that's either never been treated or it's been a progressive disease that's worsened over time. And eventually what develops is skin thickening and enlargement of the glands. And so although this is a benign skin condition, it can become pretty disfiguring because people can develop some large bulbous nodules on the nose or other parts of the face. And as you can imagine, this can really impact someone's self-esteem. And so it's really important to get prompt treatment.
So now that we discussed the many phases of rosacea, get it? It's important to know that not all facial redness is rosacea. There are many other skin conditions that can look similar to rosacea, including autoimmune disease, sun damage, and other rashes. And so consulting with your board-certified dermatologist for a diagnosis is of the utmost importance. Okay, so now let's delve into the infamous rosacea triggers, meaning what are some things that make your rosacea worse? This is a common question we as dermatologists ask our patients with facial redness and flushing in order to get a better sense of how to characterize the rosacea and most importantly, how to treat the rosacea. While the list of potential rosacea triggers may be endless, Mary, can you comment on the most common triggers?
Sure. So sun exposure, emotional stress, hot weather, heavy exercise, alcohol consumption, particularly red wine, beer, bourbon, and champagne, hot baths, spicy foods, among the most common. Can you think of any more, Rina?
Hot drinks, caffeine withdrawal, topical steroid use, cold weather, and certain foods. Most commonly chocolate, broadleaf beans, citrus fruits, tomatoes, figs, avocados, eggplant, and spinach. Basically all the fun things in life.
Okay, wait a minute. Avocados and tomatoes? Does this mean no guacamole?
While you may be sensitive to one or more of these foods, it isn't necessary to avoid them unless they cause you a flare up. So, Mary, I think it's safe to say you can continue to eat guacamole. I recommend patients keeping a rosacea diary to help identify and avoid lifestyle and environmental factors that may trigger flare ups.
That's a really great idea. Okay, Rena, so we discussed what might trigger a rosacea flare, but what causes rosacea? Is it hereditary?
Well, that's a great question. Unfortunately, the exact cause of rosacea is not really known, but there is a lot of research looking into what are the potential causes. One proposed cause is the overgrowth of this Demodex mite on the face. So, just like you have bacteria that live in your gut, there are mites that live on the skin. This mite normally lives in the sebaceous glands, also known as our oil producing glands on the skin. And it's thought that an overabundance of this mite triggers an exaggerated response from our immune system. So, this exaggerated response leads to inflammation in the skin, and as a result, the pink acne bumps and the redness. Other potential causes include a malfunction in our body's innate immune system, which is our body's first line of defense against infection. Also, an overproduction of a substance that is linked to the overgrowth of visible blood vessels on the face. Anything else I missed, Mary?
Yeah, so some dermatologists and researchers believe there is a genetic component in rosacea, and that's one of the reasons I often find myself asking my patients if they have an immediate family member who has rosacea. But despite the uncertainty in the exact cause, there are some successful options for treatment for rosacea depending on the type of rosacea that you have. So, with all the treatment options out there, what are some of the overall recommendations you have for people with rosacea, particularly over the counter options?
Well, Mary, the first thing I recommend is avoiding known triggers. Although some are unavoidable, like stress, and especially red wine for me, in addition to that, using a gentle facial cleanser, daily broadband sunscreen, and of course, an oil free facial moisturizer. I encourage my patients who wear makeup to avoid any products that may burn, sting, or irritate their skin. A sheer green tinted primer is also a good choice for a makeup base, and it may help visually correct the redness and even out the skin tone.
And to add to that, Rena, in terms of makeups, look for either a powder based or an oil free water based foundation or concealer. And in terms of sunscreen, mineral sunscreen is often a good choice for those with rosacea, as it typically doesn't contain the irritating ingredients that can be seen in some of the chemical sunscreens. And for our male listeners out there with rosacea, using an electric razor is helpful to avoid the irritation of a dull razor blade. Also, avoiding any shaving creams or lotion that can burn and sting, and instead opting for a gentle post-shave balm or moisturizer can help soothe the skin and prevent rosacea flares. So, Rena, beyond gentle skincare practices, are there any other medicated products that patients can get over the counter?
Yeah, a lot of my patients often ask me this question, and what I recommend are products that contain azelaic acid. This is an ingredient that has antibacterial properties and can help fade the background redness. My top pick is the ordinary azelaic acid suspension 10%, and always a plus, this is super affordable. Another product that may be helpful is niacinamide. This can be found in some moisturizers, including the Ordinary brand. Although the mechanism is not fully understood, it is believed that niacinamide can help improve the skin barrier and hydrate the skin. And this can potentially reduce the exposure to irritants in the environment that trigger your rosacea. So, moving on from the over the counter products, Mary, can you tell us more about some of the prescription options we have for our rosacea patients?
Sure. So, in terms of prescription topicals, there's so many options out there, and they all work in different ways. Some topicals have anti inflammatory and anti mite properties, and others constrict dilated blood vessels. It's important to talk to your dermatologist about what option would be good for your skin, particularly because some of these products can actually cause a rebound redness and swelling, which can be pretty intense and uncomfortable, and definitely not ideal.
That is good to know. Low doses of oral antibiotics can also be helpful to decrease the inflammation in the skin, especially in those with acne rosacea, ocular rosacea, and persistent facial redness. Many of my patients are on these low doses of oral antibiotics for months to years in combination with topicals.
These are all great options. But Rena, I have a number of patients who do not find successful clearance of their facial redness with all of the treatments we mentioned, or they're either not interested in a topical or oral option. Do you have any other recommendations for these patients?
Well, that's a great point. For the challenging cases with stubborn facial redness, an additional treatment option is to target the dilated blood vessels with either a laser or light treatment. Typically, 3 to 4 treatments are needed with a yearly maintenance. Laser and light treatments come with their own risks, and so it is important to do your own research and make sure your provider has been adequately trained.
Well, that's all we have for today. For those who are looking for some more information on rosacea, the National Rosacea Society is a really helpful online resource with tons of information about rosacea. Tune in next week as we discuss the treatment that all of our friends and family keep asking us to skin the surface of, Botox, and whether it's the right treatment option for you.